Will hydrogen peroxide cause temporal weakening of our taste sensitivity when used as oral rinse agent as suggested by some dentists? I tried 3 times today, but in the evening I felt the apples didn't taste the same as yesterday, especially the first bite. It was pretty sweet, not anymore now.
Welcome, and thank you for putting your trust in me. I have never heard of such an effect, although it is certainly possible, and intuitively possible, that peroxide rinses might cause gustatory, taste, change. Hydrogen peroxide, depending on its concentration and the level of tissue sensitivity of a particular individual, might cause burning or thickening of the surface, epithelial, tissues of the mouth and tongue, the same tissues that carry the special sensory receptors of taste, the taste buds. Whether the peroxide is responsible for your taste perceptual alterations is uncertain, and a substantial part of what contributes to overall taste experience is actually derived from smell sensation. However, because the use of hydrogen peroxide is certainly not an essential part of a daily oral hygiene regimen, you would not be depriving yourself of any value if you discontinued use of this product for a few days to see if your taste perception returns. If it does, the most pragmatic strategy would be to omit the peroxide rinses, and rely more on the mechanical oral hygiene methods of brushing and flossing. If, on the other hand, your taste perception continues to manifest with some degree of impairment, you should consult with your primary care medical doctor for a formal exploration of the upper respiratory and neurological conditions that are associated with taste impairment. Hope this helps.
It appears hydrogen peroxide is helpful in dealing the toothache I have been experiencing recently. Interesting enough, when it happened, I ran through my dentist and a specialist in the same day. Unfortunately, neither of was able to identify the cause, which left me in doubt if I should keep them on my list in future. The specialist only did a cold/hot sensitivity test plus an X-ray. Are there any other better diagnostic work to be done before they should tell me to do a root canal or pull out?
There is a specific diagnostic protocol when attempting to isolate the source of dental pain. This includes an assessment of the presenting history of the symptoms, an interpretation of X-rays, and a sequential challenge of the suspect teeth with a series of provocatory stimuli, for example, percussion, cold, heat, etc. I cannot know whether your dentists have implemented the customary diagnostic procedures in your case, but they are well known, and I will assume that they did. You do not specify that particular discipline of the specialist with whom you consulted, but it would have been most appropriate to have done so with an endodontist, as this is the specialty best qualified to deal with such diagnostic issues. In any case, most diagnostic tools and tests have a threshold of sensitivity, and if a dental infection is at its initial stages, it is apt to fly below the radar until it progresses to the point where its manifestations are more conspicuous to those diagnostic tests. Therefore, if there is any uncertainty as to either the culprit tooth, or what is wrong with the tooth, any irreversible therapeutic intervention should be delayed until the problem is more conclusively identified. In the meantime, management should be limited to symptom control. As for deciding between root canal therapy and extraction, this is a decision that is based on several criteria: the functional and strategic importance of the tooth in the overall context of the mouth, the relative merits of the treatment alternatives, the feasibility of root canal and the predicted outcome of such treatment, and the structural and periodontal condition of the tooth. This is a decision that should ideally be made collaboratively between you and your dentists. In the meantime, although hydrogen peroxide rinses may have been helpful, there is little doubt that your dentists can provide more effective pain control if the need presents. Hydrogen peroxide rinses are not a particularly effective pain control strategy, and can cause mucous membrane irritation and hypertrophy of the tongue tissues. You should discuss your options for pain management with your dentist if you have not already done so. Hope this helps.
If you have a health question and want to chat with a doctor now, visit justanswer.com/ythealth.